It's a really nice day, living in the right space. Breathing your grace, got me feeling some kind of way. Hi, everybody. It's Dr. Uejin Kim from Good Use Mental Health Podcast, and I have here today Dr. Salazar. Dr. Salazar and I met through collaborating with a mutual patient, and I was just so touched by how much she cared about our mutual patient getting the right diagnosis, and she gave me a lot of feedback and helpful tips to make sure that he gets the right diagnosis. And through conversations, we talked about the trend of neurodivergence and how a Christian or body of Christ should have a perspective on it, because I think there's a lot of confusing messages out there, and we'll definitely dig a little bit deep into that. So if you have neurodivergence yourself, or you have a kid or a cousin or nieces and nephew who has neurodivergence, and or you're just curious as a Christian how you should really embrace this, how you should see this, especially when the society has polar opposite response to this issue. I think you'll really enjoy this episode. So Dr. Salazar is a clinical director of Forever Hope Counseling and Educational Services. They provide services for all ages, children to adult, including couples, and they specialize in diagnostic testing and neurodiversity. Thank you so much, Dr. Salazar, for being here.
Thank you, Dr. Kim, for inviting me. I'm excited to talk about this today.
Yeah. So, as a child psychiatrist, ADHD, autism, ODD, all this alphabet soups of diagnosis, this is what you and I deal with day to day. I don't know if you can kind of share about that. I've seen trends of people asking for diagnosis like ADHD or even autism, like saying, I'm autistic, high functioning autistic, and there's TikToks, YouTube shorts out there telling people that you might have autism if you XYZ, and you're in the neuropsychological testing world. And can you just kind of explain what neuropsychological testing is and what kind of trends that you saw with neurodivergence?
So I agree. I think you're absolutely right. I see an upward trend in people wanting to be identified who may or may not be neurodivergent, but certainly are suspecting or seeking or being told or doing their own self-diagnosis type thing.
Mm-hmm.
That can be dangerous. So when we do neurological testing or neurodiverse testing, we're looking at specific standardized testing that help us measure, variations in IQ and achievement and social abilities. We're looking for repetitive behaviors, looking for a long history. There are a lot of soft signs, hard signs. I mean, it is for lack of a better analogy, it is like a mathematical equation. It is something we're putting together piece by piece. There are certainly more than just one individual putting this together. We're collecting data from home, from school, from work, from parents, from relatives, related service providers, doctors, teachers. It's very complicated to get an accurate diagnosis. So there are also overlapping conditions it can mimic.
Right.
Neurodiversity, which I see a lot of. I might have a suspicion of something, and then by the time we're done with testing, it turns out to be something else. And so
Uh-huh.
we have to be careful, even as providers, what we're trying to achieve. And so it can be very tricky.
Yeah, I think that's something that I'm always on my soapbox for, that there's so many overlapping symptoms. Like even in what you might call like simple diagnosis of major depressive disorder versus bipolar and versus anxiety, irritability can be presenting in all three diagnoses, right? So a careful and thorough examination is needed to even do that.
Right, right. And just imagine when we're talking about social difficulties, whether it could be
Mm.
depression or um, trauma. It could be brain. And there are so many different conditions can cause, inattentiveness or social, deficit looking type behaviors and things like that. And so, again, this is why we're very, very careful when we're evaluating, and hopefully the person that's doing the evaluation is thoroughly trained to do that. In our office, we do receive a lot of people that come in referred by other physicians and people who feel like they need to send them to someone has that special training to be able to help them identify.
Yeah. And just for the listeners who's kind of diving into this conversation, right? Um, so there's different level of expertise when it comes to, medication management for psych diagnosis, right? But there's also different level of expertise when it comes to diagnostic neuropsychological testing, because I think people kind of get confused that they say, oh, my therapist told me that I have autism, or my therapist thinks I have ADHD. And when they come to my level, it's a screening questionnaire that the therapist did, and they just want like a second opinion or clarification. Can you explain to us, for the listeners, like, when you hear the diagnosis from therapist's office or, Christian counseling office, right? Like, just so that the listeners know, oh, if I have a strong suspicions of this, then I should seek this care or this service.
So I really appreciate the work that the community is doing in our mental health community, right? Whether it's counselors, therapists, psychologists, doctors, pediatricians, teachers, people that work with the community, children specifically, but all ages. They might hear, oh, I think, as you mentioned, I think, you might be struggling with this or with that. But to me, those are opinions, right? Those are suspicions. You can even say it might be, if it's somebody who's trained and licensed, like a therapist, you could say that's a clinical impression.
Uh-huh.
Taking kind of a guesstimate that this is what you might be struggling with. When we're talking about neurodevelopmental conditions, I love the way you put that, Dr. Kim. There's different levels, right? And so you've got that front line where you're sitting with a counselor or a therapist or a doctor in a checkup or something, and somebody is saying, I wonder if it's this. Starting to
Uh-huh.
look a little like this. So that's when you take it to the next level and get the actual evaluation that can confirm or rule out that suspicion. We have to be careful not to take that information as a diagnosis when we haven't been formally evaluated.
Yeah. And I want to kind of really emphasize the collateral information and collaboration that needs to happen, because this one particular case that we discussed, they went to multiple neuropsychologists and
Mhm.
didn't get, the diagnosis that I thought was my hunch, right? And what it took was me actually making a phone call with the psychologist in that practice to really figure out, was there any parental bias, like in presentation during the neuropsychological testing, and
Right.
what was I seeing? So there was a lot of heavy collaboration with that specific case. So the the beauty and the complexity of mental health diagnosis, it's not just like a TikTok reel and a list of symptoms. Boom, you have this, boom, you have that. I just hope that the audience appreciates that coming to a diagnosis, it does take a lot of expertise and collaboration to really fine tune and tweak the diagnosis.
Mhm. Yeah, I sometimes explain it in a way that I'm hoping would be helpful. It's almost like the shades of blue. So you're starting from the white, pure white color, all the way to the midnight blue. And then as those different variations in color will increase in the complexity of that blue, it has to be a specific shade or more, right? And so you could have some blue, but that doesn't necessarily mean it's what you're suspecting.
Right, right. Everything is in term spectrum. Every diagnosis is a spectrum, and we just have to meet that criteria.
Right.
Um, let's just shift gears, because I did mention that there's a trend of rising, and everybody kind of wants, either they want the diagnosis of autism or ADHD, or they're just like so scared. And I think this is so true in Christian church.
Mhm.
Um, I've seen people who, even with other mental health diagnoses, saying that, my faith is gonna, you know, cure me of depression. I don't need medication, or I don't need therapy. They're very hone in on specific diagnosis or specific treatment options, right? Because of their faith background.
Mhm.
What have you seen, as a Christian, maybe in your church or something like that, their attitude or perspective on neurodivergence, that you could say, oh, that's accurate or that's not accurate?
Well, I think there is some controversy, there is some confusion, there is some fear, I would
Mm,
say. exists in our Christian communities. And we've been helpful in a sense that when we have a family that's coming in with either very strong religious views or affiliations or a faith that, might even hinder them from coming in to get treatment, is sharing the fact that we do share the common faith so that they
Mm-hmm.
feel safe to share and what they're fearing and what their apprehensions are towards treatment. And then just giving them a lot of psychoeducation about, we do use evidence-based strategies and techniques to evaluate and to treat, but we also look at this through a Christian lens and we remember who we are. We're created through Christ, and what those expectations are for us and our purpose, and bringing up our children, and maintaining our families. And so I feel like having that solid foundation, and recognizing and sharing that with our clients has been very helpful for those
Yeah.
communities struggling with seeking treatment.
What kind of fears, maybe specific fears, have you um, run into? Maybe some of our audience might have those fears.
I've seen, well, particularly people fearing medication.
Mm-hmm.
I see that. Um, the counseling realm, being able for people that are in very important roles in the church to be able to get treatment and admit that their family member or loved one is struggling in some way, whether it's with addiction or depression or suicidality, because they do believe that, sometimes prayer is enough, and that,
Mm-hmm.
God will take care of them regardless of there's been an attempt or there's a risk for a high attempt on their life.
Mm-hmm.
So I work particularly well with a lot of families who are struggling in that aspect, and have been able to do some very good, powerful work there. But I feel like that has been how we're used. The Lord works through us, and
Mm-hmm.
sometimes we're not sure what angle to take with a family member who might be struggling in that way. But we do use, the psychoeducation piece, the power of prayer. Some scriptures are very helpful for that as well. And so it takes a lot of patience and a lot of, just going at their pace and allowing them to digest all this information that could be very shocking for family members.
Yeah, I think with um, mental health struggles potentially being like a skeletons in the closet, right? And we just want this facade that if God is with us, then we shouldn't have any struggles, or we should be fine and we should be happy and singing praises all the time, right? This expectation of having a Christian life, I think, brings a lot of shame when skeletons in the closet is can be no longer hidden in the closet, and there's a lot of I think reputation for themselves, but maybe they're worrying about reputation of what God could be perceived if they're struggling with this.
That's a very good point as well. Yeah.
Do you have any stories of I mean, just to give hope to our listeners, right? Um, do you have any stories of what you said that really clicked, with somebody who was struggling with this kind of shame and guilt and maybe fear, and you were like, oh my gosh, I wish that everybody kind of knew that.
Oh, that's wonderful. Well, having worked with so many families over very close to 20 years, there's probably a lot of stories I can think of. But one of the more recent ones that I would say was helpful for me too, as I grow, working with
Mm,
people, I learn something new about how I interact with others as well. But being able to show that compassion piece, that even though we're clinicians and we're helpers in the community, we also share the same common love for Christ
mm.
and for our children. So there's a fine line, right? We have our boundaries as therapists and clinicians, but
Yeah.
being able to help them recognize that we have families too, and we have children, and so sharing our commonalities of our struggles sometimes, and letting them know that we all are meant to connect with one another and seek each other for support. Um, Even we've had pastors and priests come to our office where they're needing private spaces to share. And so those have been some really strong success stories where we see people that wouldn't otherwise feel like they could come forward, that have had the brave decision to come forward and seek assistance from somebody. So yeah, I wish we could share more about that, but just trying to protect privacy.
Yeah. No, that's really powerful that you have seen pastors and priests kind of come through your office and asking for help, because those are the true leaders of the community. And I'm so glad that you're hand of compassion in that vulnerable spot for the leaders too, because it's hard to admit when you're leading a congregation to say like, hey, I need help too.
It's a very humbling experience, actually, because I'll sit in prayer before some of the sessions, and I won't know what I'm going to do with a certain person or how I'm going to work with a certain person. And then when the session begins, it's like it just flows through, and I feel like
Mm.
us to do that because he's the one who's sending these people our way. And
Yeah,
so together and connecting with the community is very important, but also leaning on God to give you the right words and the right guidance and techniques and tools.
yeah. And just like sharing space, sometimes I'm such a fixer, so sometimes I want to, you know, come up with this like perfect analogy or perfect answer, and a lot of times the healing comes through when I'm just like silent with my patients and just saying, I'm sorry, that sucks.
Being able to get through that and letting them feel what they need to feel. I think that's
Mm.
very important.
Wow, I love that. Going back to the neurodivergence, I know that society is so polar. One side just wants it and is like neurodivergence is like a trendy term now. Like everybody's neurodivergence, and there's acceptance and tolerance and accommodations. But the other side, like I have one parent who like refuses to get neuropsychological tests because the mom fears if he gets diagnosed with Asperger's or autism, then he won't be able to get certain jobs like military. Like we fear the diagnosis. So we have polar opposite reaction from society. And you mentioned that you have the Christian lens that everybody, no matter where you are, what diagnosis you have, is an image of God. And we talked about this through our text.
Mhm.
Can you flesh that out for us? Like, if there's a Christian parent who's like, what if they get the diagnosis? Like, I had some speculations. Do they have ADHD or autism? I'm really afraid of the stigma that my child will get by having that official diagnosis, what it means for a job or community. Like, how can I embrace this journey as a parent walking with their kid to get the diagnosis and get the help?
As you're giving that description, immediately the thought that comes to mind is the amount of parental shame that's associated
Mm.
with these diagnoses. Sometimes they feel like it's a reflection on their family or their child. They're trying to protect, really don't want them to experience, the being treated different. And, they describe their fear. My hope is that parents recognize that their child usually at an early age understands that there is a variance in their development,
Mm-hmm.
right, of some sort. They don't have
Mm-hmm.
the answer. They don't know why they feel that way or why they interact this way, but they're aware that it's there. And so my hope is that parents see that our job and responsibility is to prepare our children for when we're not here. The Lord calls
Mm.
first, hopefully, before our children. And our children are left here alone, on earth. And so, how do we help prepare them for that? If it does mean accommodations, great. Some people with that diagnosis don't need any accommodations, but at least they get some answers on those variations that we're talking about. And it gives
Yeah.
solid validation that this isn't just in my head. There isn't anything wrong with me. It's just I see things different. I interpret and interpret my world different. So I think if anything, I think it really strengthens that individual. I see a lot of everyone that I've tested. I see a lot of relief.
Mm-hmm.
My clients, from the little ones all the way through the older ones. I've had lots and lots of teenagers, but many adults, even somebody as old as in their 70s, who's been
Mm.
tested and took all their life to get validation
Yeah.
and suspected for a while and had been struggling with family members and getting along at work and things like that. And so that validation piece is very healing. And then it's up to the family whether they want to share it or not. But for the
Right.
individual themselves, I compare it to any other type of diagnosis or developmental diagnosis. If they had something going on, would they want to know? And would it be helpful to let their children know? And, the answer is usually yes, it is. Whether it's a cavity, you can't say, well, we're just not going to tell him he has a cavity. It's going
Yeah.
to be worse, right?
Yeah.
So different analogies like that, and just to kind of give them something to think about if we withhold information, how
Yeah.
much damage can be done with that. Um,
Yeah.
so it's been pretty successful so far, where people feel like it's a safe space for them to share their concerns, their feelings of maybe some embarrassment or shame, or just questioning what good would this do. Maybe it's not an embarrassment or shame, but it's kind of like, well, how will my child benefit from this? Um,
Mm-hmm.
Especially some of the higher functioning individuals who might be ready to go off to college. Academically, they're superior, but socially and behaviorally or emotionally, they're struggling. And we talk about some of the dangers that things that could happen if they struggle away from home. I've seen people get full ride scholarships and, less than half a semester they're back home because, executively with their functioning, they weren't able to take care of themselves. Um,
Right.
Educationally, they were great. Academically, they were great, but they struggled in so many other ways that could be potentially dangerous, especially if it's depression.
Yeah. It's something that you kind of mentioned, like cavity. We can push it away. We can like minimize the symptoms, but it does get worse. And that's why I love the work of child psychiatry because, you know, earlier you treat and get the diagnosis, get the clarity and get that sense of self-worth back because let's be honest, our kids' sense of self-worth and self-esteem is going to get judged and assessed by teachers, by peers, by grades. But the earlier the kid themselves know, oh, I have these tendencies, or I tend to interpret facts or social cues like this, then it really empowers them to make choices and reinterpret their self-esteem, in a different way. And one of the things that I love the most is that earlier diagnosis and treatment does help individuals to pave their own way. That's a little bit different, but they have the full confidence and ownership and autonomy about that.
Right. And I think that validation is key, because once somebody understands a little bit more about themselves, they now know what are some options, what are some things I could be doing to work on this. It's not I've heard some parents say, well, we don't want them to have a crutch. We don't want them to have an excuse. We don't want them to think it's okay, to whatever.
Mm,
And of course we don't. I mean, all the rules still apply, all the expectations still apply. We want self-sufficiency and all those things. But what can we do to help them get there? It might look different. We may need to go a different path to get them to that place in life that we're aiming for.
yeah.
So, it does help parents see that there is support and a different way to look at this. And going back through the Christian lens piece is helping them see that that child was wonderfully made. I tell parents, you were chosen as their parent. I feel, for me, one of my sons is on the spectrum, and I was chosen to be his mother,
Mm,
elected. And to me, if we can really hold on to that and know that, we have a strong purpose in our life, and parenting is one of the biggest jobs that we'll ever encounter. But even parenting, on top of that, with somebody who might have struggles that our other children may not have. It can be very challenging for us as parents. And so helping to work with those parents has really made a difference as well, not just working with the individual, with the family system as well.
yeah. And you mentioned a Christian perspective, and it just made me think about Jesus versus Pharisees, right? And I hear the same thing, parents saying, we don't want them to be weak when they get the accommodation. Like, I don't want them to get any accommodation or 504 or IEP, special ed at school because it's going to make them weaker. And I feel like if you flip that logic around, so it's like, so you're saying they have to, with this neurodivergence, you have to meet certain kind of expectation and make the kid struggle through to maybe get there. And that's kind of like what the Pharisees were doing, where there's like set of rules. Well, you have to follow XYZ to be accepted and validated by society. But then what you and I are kind of saying is that being Jesus was, we're still broken as sinners and we're still making mistakes. But
Mhm.
Jesus showed grace where we're at and met us where we're at. And really what it kind of does is that it meeting the kid where they're at and speaking the language that they're speaking. Because with speech impediments or speech delay or autism, I tell my parents, it's like, they're still communicating.
Mhm.
And we can't expect them to say, talk like us and think like us and, communicate like us. They're still communicating. We just have to learn what they're saying, so that they can really express themselves too. And I think that's like really the heart of Jesus with the work of not necessarily getting the earlier treatment and diagnosis as like the option, but exploring where are you at,
Mhm.
and how can we be next to you?
Mhm. That is exactly. I think that's an excellent example of the heart of Jesus coming to all of us, meeting us where we are, knowing that none of us are perfect or have it all together. We have a purpose. We know we're created for that purpose, and it's our job to find a way to live through that and do what we can to glorify Him and strengthen who we are as a person so we can set out to do that purpose. And I reinforce to parents that their child, regardless of their age, their condition, whatever it is that they might be struggling with, has a purpose. And when
Mm,
they help them figure that purpose out, that doesn't change that. Um, and I want to emphasize again, not everybody who is tested or has a neurodivergent type of background necessarily needs accommodations. Many do, but not everybody does, right?
right.
We're all individuals. It's what can we do to help that child or adult reach their fullest potential. And sometimes that is through therapy, through counseling, through behavior work, through medication, through support, through acknowledgement, awareness. And it could be so many different things. It's not always automatically condition equals accommodation,
Yeah,
that kind
you're
of thing.
right.
That drives a lot of the fear behind some of these families.
Yeah. No, I'm so excited about this episode because I hope that everyone who had those what ifs, I think, and they watch TikTok for 5, 6 hours, rabbit trailing with specific diagnosis that maybe they or kid had. I think this gives hopes that there are providers like you who are balanced in using evidence based diagnostic tools, but also whole person lens thing. Your purpose is not lost. In fact, maybe we can clarify what your purpose is by
Mhm.
understanding who you are, right?
Mhm. That's wonderful. If we could do that for everybody, imagine Dr. Kimmer would be with all of us. I mean, that'd be amazing.
Yeah, well, that's what I try to do, one episode at a time, and you're here.
That's so exciting. I think with parents, if we can remind them not to be afraid,
Mm,
I tell a lot of my families that one of the most common scriptures in our Bible says, "Do not be afraid," and it's written.
right.
Ironically, it's 365 of those
Yeah.
scriptures. Do not be afraid. Do not be afraid, and that's one for every day of the year.
Yep.
Not because we're walking through life, happy and I'm thinking everything is perfect, but because He's reminding us that we're not alone, that
Mm,
we are equipped, that we have things in place for us already that we could follow, to do the best we can with our children, not to exacerbate, not to anger, all those things that we could be doing to strengthen us as parents, seeking resources in the community, leaning on one another, being open about the fears that we have, and um, getting that support through our network, whether it's with doctors or counselors or neighbors, or people in the church. We have resources. We don't have to go through things alone as a parent because it can be very scary.
yeah. Yep. Especially with exploring mental health diagnosis for your kids. So it's not a small task. Well, Dr. Salazar, I'm so glad that we had this conversation. And I'm so glad that your spirit of calmness and compassion came through. I know that the audience is going to be wanting to follow you and seek out your services. I'm going to put the link in the description box, but can you tell us a little bit more about your practice and what you offer as services?
Sure. We have two locations. San Antonio, Stone Oak is the larger location. And we also have the Bernie location in downtown Bernie, right off of Main. We see all ages. I think the youngest I've tested has been 19 months for autism. Our module started 18, so he made the
Hmm.
cutoff.
Hmm.
And the oldest, as I said earlier, was into their mid 70s. And so we recognize conditions such as ADHD, autism spectrum, dyslexia, dyscalculia, um, selective mutism, anxiety, depression, things like that. But we're really helping to find whether somebody has adaptive needs that we could be helping in the workplace or in the academic arena, whether it's college or K through 12. And then we offer family counseling and therapy, just helping people, build those relationships and feel supported at home, whether they're struggling maritally or with family relationships. To me, that's what gets me up every morning is working with, especially with parents, but working with
Mhm.
family members that need some support.
Yeah.
And again, not everybody that comes to our office is Christian or wants faith-based counseling, but I am honored that they still choose to come to
Yeah.
our office and our facility. I feel like the Lord leads people to us for different reasons, and we're very respectful of everybody that comes through the door. But I do hope that when they are there, they feel the love of Christ because that's our duty. That's what we're
Mhm.
called to do throughout our life. I get to do it in a counseling fashion, but that's what my purpose is.
Mhm. Yeah. Well, thank you, Dr. Salazar, for your time, and I hope that the audience gets the hope and, like you said, just somebody who's next to them going through this journey that might feel scary at first. So thank
Yeah,
you so much for your time.
very, very welcome. Thank you.
Hey guys, if you like content like this, then check out my free webinar called How to Be More Present, Peaceful, and Poised Without Losing Your Schedule, Savings, or Sanity. Scan the QR code or check out my bio to get the link.